Welcome to the IHH for Veteran weekly live stream. Here at IHH, we specialize in assisting veterans with their physical and mental health transformation. This group addresses the unique challenges of veterans to improve their overall quality of life. Many veterans have expressed they have questions regarding veterans and cannabis use, benefits, restrictions, and call for change. So we will be reviewing this blog this evening. Individuals should have access to therapy options that are effective in improving quality of life without damaging side effects. Currently, veterans who have risked their lives to serve and face several barriers to access in our healthcare system. This includes limited availability of facilities or specialties, resource constraints that impact quality of care, and delays in benefits. Despite studies to support the use of alternative therapies such as cannabis to address the life-limiting and debilitating conditions veterans face, VA is prohibited from recommending or offering support to a veteran when it comes to cannabis use. This leaves many questions unanswered and several veterans self-medicating versus receiving proper guidance from a healthcare provider. Here in this blog, we'll detail the problems with the currently available treatment options, research to support cannabinoid therapy as a wellness option, how to get involved in your woman's veteran study, and additional resources for support. What problems are veterans seeing with currently available VA-approved treatment options? The selective serotonin reuptake inhibitors, or SSRIs, are considered the first-line pharmacological treatment for post-traumatic stress disorder, or PTSD. However, even when treated with this class of drugs, response rates rarely exceed 60%, and less than 20 to 30% of the patients achieve full remission. The well-known difficulties in managing PTSD are aggravated with the patient does not respond or does not tolerate treatment with antidepressants. Findings highlight the fact that symptoms of PTSD are heterogeneous, and each of them may respond differently to specific medication and provides a strong stimulus for investigating new symptom-specific drugs. New treatments for PTSD are needed to reduce the suffering and the disability associated with disorder. Benzodiazepines are frequently prescribed by physicians in the aftermath of a traumatic event in an effort to prevent the development of a psychological sequel, or if PTSD eventually arises, it reduces post-active symptoms like hypervigilance or control-associated non-specific behavioral disturbances such as marked anxiety or agitation. Thus far, there is no compelling specific scientific evidence of the effectiveness of benzodiazepines either in the prevention of PTSD or in the treatment of its core symptoms, although clinical experience suggests that they may improve sleep and agitation, at least in the short term. These limited advantages must be weighted against the market potential for addiction that characterizes this class of drugs, particularly considering that PTSD patients have higher rates of drug abuse dependence than the general population. U.S. military veterans have been heavily impacted by the opioid overdose crisis, with drug abuse mortality rates increasing by 53% from 2010 to 2019. Opioids in particular have considerable side effects, including constipation, impaired sleep, and respiratory depression. The rapid increase in opioid use and opioid-associated mortality is largely attributed to use of opioids in chronic pain treatment. Suicide rates have been historically high among young veterans and older veterans as well. In the 20 years between 2001 and 2020, the suicide rate among veterans between the ages of 18 and 34 increased by 95.3%. Factors that play a role in the high suicide rate include acute psychosocial stressors, higher doses of opioid medications for pain control, insomnia, mental health conditions like anxiety disorder, manic depressive disorder, depression, post-traumatic stress disorder, and traumatic brain injury. Substance misuse, especially heavy binge drinking. At the clinical level, suicidality, which encompasses suicidal thoughts, ideation, plans, attempts, and completed suicide, is considered associated with affective disorders, chronic pain, anxiety, psychosis, substance use disorders, and sleep problems. Cannabis benefits for veterans. Remarkable quality of life improvements are attributed to medical cannabis use. Many life-limiting conditions plague the veteran community, from sleep disorders to epilepsy to PTSD, all of which may be alleviated with guided cannabis use. There have been two observations of importance that have led researchers to further explore cannabinoid therapy as a PTSD treatment option. First, patients with PTSD were found to be more likely to consume cannabis as a form of self-medication in an attempt to reduce their symptoms of anxiety and disrupted sleep. Secondly, patients with PTSD were shown through research to have increased levels of cannabinoid receptors while decreased peripheral levels of the endogenous cannabinoid, anandamide. This means those suffering with PTSD may experience an anandamide deficiency. Due to the modulating effect of CBD on the ECF, which is endocannabinoid system, and considering the many body processes that the ECF regulates, CBD has seen increased research for potential value in several conditions. Research has stated that the ECF can provide more efficient and better tolerated alternatives to the standard treatments for PTSD. The potential of CBD therapy has been repeatedly demonstrated in animal modules of traumatic event exposure, as well as anecdotally in humans. CBD in particular is promising, as it has been researched for its effectiveness among general anxiety disorders, depression, and traumatic memories, while proving to be well tolerated by humans, both in overall safety and possible side effects. A comprehensive review of 132 original studies by researchers described the safety profile of CBD. Chronic use and high doses of up to 1,500 milligrams per day have been repeatedly shown to be well tolerated by humans. Preliminary clinical trials also support the efficacy of CBD as an analytic, antipsychotic, and antidepressant, and more importantly, a positive risk-benefit profile. These promising results support the development of large-scale studies to further evaluate CBD as a potential new drug for the treatment of these psychiatric disorders. CBD could sufficiently reduce opioid use and improve chronic pain and sleep quality among patients who are currently using opioids for pain management. 53% of participants from a 2020 study reported reduced or eliminated their opioids within 8 weeks after adding CBD-rich hemp extract to their regimes. Almost all CBD users reportedly quality of life improvement. Data indicates that repeated administration of CBD may produce an effect that is consistent with results from studies testing traditional antidepressant medications. So what does the VA say about veterans and cannabis? Per the U.S. Department of Veteran Affairs, some things veterans need to know about cannabis and the VA are: veterans will not be denied VA benefits because of cannabis use. Veterans are encouraged to discuss cannabis use with their VA provider. VA healthcare providers will record cannabis use in the veteran's VA medical record in order to have an information available in treatment planning. As with all clinical information, this is part of the confidential medical record and protected under patient privacy and confidentiality laws and regulation. VA clinicians may not recommend medical cannabis. VA clinicians may only prescribe medications that have been approved by the U.S. Food and Drug Administration for medical use. At present, most products containing THC, CBD, or other cannabinoids are not approved for this purpose by the FDA. VA clinicians may not complete paperwork forms required for veteran patients to participate in state-approved cannabis programs. VA pharmacies may not fill prescriptions for medical cannabis. VA will not pay for medical cannabis prescriptions from any source. VA scientists may conduct research on cannabis benefit and risk and potential for abuse under regulatory approval. The use or possession of cannabis is prohibited at all VA medical centers, locations, and grounds. When you are on VA grounds, it is federal law that it is enforced, not the laws of the state. Veterans who are VA employees are subject to drug testing under the terms of employment. Providing a direct service to veterans, how realm of caring may help. Finding support and recommendations for CBD therapy and PTSD can be difficult, but that is where the nonprofit Realm of Caring, ROC, may step in to help. Since 2013, trained ROC care specialists have helped with product and practical administration suggestions. In general, tested CBD products are safe, but responsible use and guidance, as well as oversight by a healthcare professional whenever possible, are always recommended. ROC is here to help start and facilitate those conversations along the way. ROC provides a free cannabinoid therapy education hotline for anyone who seeks more information and guidance. ROC has helped more than 72,000 people worldwide with one-on-one support to find a product and routine that serve their needs. ROC gives each client the extended time they need, follow-ups, and ongoing support that go beyond product knowledge. For example, how to talk to your doctor, where to find research-backed information for a specific condition. ROC founders realized that to truly legitimize CBD therapy and advocate for patient access, research needs to take place. There is a critical need to identify new treatment options and give a voice to many underrepresented communities, to include the veteran community. Realm of Caring is actively recruiting for an IRB-approved in-depth observational study of cannabis use among female veterans. This will be a longitudinal study conducted over several months to assess health outcomes related to cannabis use. Additionally, extensive quantitative data in the form of interviews and open-ended survey questions will assist firsthand narrative experience to give a voice to this community. Throughout the study, the participants will be offered guidance and support by our medical care team. After completing each survey, they will also be compensated for their involvement in the study. Participants are volunteers and can withdraw from the study at any time. Additional resources for veterans. The Realm of Caring is proud to partner with veteran-focused organizations who care about enhancing the quality of life for our heroes. Click below to learn more. There's the Adaptive Training Foundation, which provides access and inclusion to individuals living with physical or traumatic impairments by empowering them through exercise and community. Irreverent Warriors. Irreverent Warriors knows the best support network for veterans is other veterans. We bring a community of warriors together through therapeutic events across the country. We also work with other veteran organizations who provide services such as job placement, training, housing, service dogs, and more. Hero Grown. There are over 20 million military veterans and tens of millions of active and retired first responders. In the shadows, a countless number of these heroes are desperately struggling with addiction to deadly drugs prescribed for service-related injuries and psychological disorders. Hero Grown Foundation is the preeminent organization fighting for their right to choose cannabis as a safe alternative. To schedule a complimentary assessment, go to my website, veteransvictories.org. Thank you and good evening.